Hello and welcome to the Mindful Men podcast, a show inspiring men to be mindful about their lives. Each week, we'll dive into a range of topics that matter to men and hear from everyday people doing extraordinary things. So if you love the show, please give it a 5-star rating and share it with your mates. Now, before we get into this week's episode, please note that some of the content may trigger you. And if this happens, please reach out to your support networks. It's really important. If you can't get enough of Mindful Men, head over to our website. It's www.mindful-men.com.au. Find the show notes and the links to our socials there. But for now, sit back, relax, and let's get mindful. G'day guys, and welcome to another episode of the Mindful Men podcast. I'm your host, Simon Rennie, and today we're getting mindful about compassion-focused therapy, or CFT, and I'm really excited about this because as a private practitioner myself, I've never heard of it. So I dare say most of you out there have never heard of it as well, but we have got an expert coming in to share about what it is, how it works, how it can be useful for men. And joining us to do that is Dr. Dan Steindl from the sunny coast. How you going, Stan?
I'm pretty good. It's hot up here, as we were saying.
It is hot.
Summer has arrived.
I've just dipped my toe in the pool outside, and it is like a warm bath, and it doesn't feel good at all. So it is terrible. But you were saying that you were on a walk at Mooloolaba Beach. Talk us through the walk. How good was it down at Mooloolaba today?
Yeah, well, I have this Apple iWatch thing now, and so I must close my rings, and I'm not sure if my watch is a sort of a slave driver or a compassionate friend, actually. I'm not sure, but something about the watch motivates me to get out and go for a walk every day. Oh, yeah, no, I mean, it's beautiful. The skies are blue and the sun on your back is very, very lovely. I think we'll have a good summer.
We are recording at the first day of summer, as it is. It's the 1st of December today, so on the day that we're recording. So this won't come out for a little while. So when you do hear it in the future, just think back to that first day of summer and thinking about where you were, what you were doing. We're about to start school holidays, so I dare say the beaches are about to get a lot more packed in the next coming few days and weeks. But Stan, to introduce you to the audience, you're a clinical psychologist and you're in private practice as well at Psychology Consultants. You're also an adjunct professor at the University of Queensland School of Psychology, and you have a major interest, should I say, in compassion-focused therapy. So before we get started, I'm interested, how did you come to be in the clinical psychology field? It must be something that you're either passionate about, or do you have lived experience? What drove you to that?
Oh, yes. Okay. Well, I suppose I'm now 52, so that story goes way back probably to sort of high school, really. Funnily enough, I did have a tricky grade 11 and was sort of struggling along, and then one of my older friends actually gave me a book, Man's Search for Meaning by Viktor Frankl. I don't know if you know that one. It's quite a powerful book. He describes his experiences in Auschwitz during World War II and so on, and also his idea of how it might be that even in the most difficult times we find perhaps meaning and purpose in our lives, and that might be sort of through our relationships or our work or our suffering, that these things can be important sources of meaning. And so that really resonated with me at the time somehow. I don't know. It got me onto reading other psychologists, Carl Rogers, Fritz Perls, and so on, but also some of the philosophers, Nietzsche, and all the rest of it. I was having a heavy year 11. Let's put it that way.
I was going to say I was not reading anything at year 11 outside of the back of a Nintendo 64 video game box, but that's about it.
Yeah. No, there was all of that too. Don't get me wrong, but. No, it was interesting, and I don't know, especially Carl Rogers probably was an important inspiration to becoming a psychologist, a therapist, I suppose, and just that idea of being with another person, trying to really properly empathize and listen and understand and try to be helpful, I guess. And so in that early stage, I really developed this kind of concept of wanting to do psychology and become a therapist, and went to uni and sort of all of that sort of thing. I got into private practice, obviously a bit later, had worked elsewhere, got into private practice One of the areas of real interest for me was another approach called motivational interviewing. I'm not sure if you've come across that one. Yeah, so that was an early interest, which is really just about helping people change. And actually, a lot of my early work was with men, often veterans, actually, combat veterans who were experiencing post-traumatic stress disorder, but also problem drinking, I guess. And so motivational interviewing draws a lot on Carl Rogers, on trying to listen and help people to explore their ambivalence about change. People often have lots of arguments for change, actually, which is interesting, but then they often will have certain arguments against change. So MI is really about trying to navigate that ambivalence and sort of see if we can move towards some sort of change. One of the components, I suppose, of the spirit of MI is compassion, is trying to have, the other person's well-being as a priority, trying to work towards their health and well-being. And so a little bit further along, and I started to think, well, what is compassion? Which is an interesting question in and of itself, actually, like what is compassion? I arrived at this approach called compassion-focused therapy, which is really, and we can talk about this some more, I guess, too, but it's really about trying to help people to develop within themselves a kind of a compassionate mind. In other words, how can I be sensitive to my own suffering and the suffering of others? And how can I try to kind of work out just what it is that might be helpful to alleviate my suffering or suffering in the world, or perhaps even try to prevent suffering? So that's where we sort of landed this sort of MI-CFT kind of combo.
It's interesting time that we're having this conversation because I am talking to a lot of guys in my therapy practice around self-compassion, about not being so hard on themselves whenever something happens or maybe they succumb to the alcohol or the drugs or whatever and they're trying to get clean or something's happened with their partner or their kids. I'm just like, just go easy on yourself. You're doing the best that you can with the tools that you've got, and I'm here to guide you along that way. On the flip side of that, I'm also saying this to myself as someone in private practice trying to grow a small business and do all the things. We were talking a little bit before off air about me trying to, do my podcasting stuff and do my social media stuff, plus have a private practice and do all the admin and the marketing and all that type of stuff. And sometimes I just get really hard on myself and go, this is all too hard. Why am I doing this? The things aren't working, or I'm not getting enough referrals and all this stuff. And I just take a moment to reflect on how far I've come in 18 months or so, but also just going easy on myself. I can go slow. I can make mistakes. Things will be okay. I've just got to be gentle on myself. So this is a very timely conversation, and this is why I wanted to jump at this when this popped up. So before I get into compassion-focused therapy, you said that you went through a few definitions or about what compassion actually is. So can you highlight for us what you think compassion is and why is this important?
Yeah, it is. It is an interesting area because there are different schools of thought, I suppose, in terms of what compassion is. But when you kind of sort of bring it all down to its fundamentals, I guess a good definition is, compassion is a sensitivity to suffering in self and others with a commitment to try to alleviate and prevent it. Actually, you can sort of sense there's those two components there of compassion. There's what they call compassionate engagement, which is the sensitivity, the awareness, the noticing of suffering in self and others. So right in the definition, actually, it includes ourselves. So that's sort of important. And then the second half is what they think of as compassionate action, which itself is a motivation or a commitment to try to alleviate and prevent it, because it's not always easy to take suffering away, but we have this commitment to try to make efforts to wisely try to alleviate suffering.
What is suffering then? Because everyone has different ideas about what suffering is. So to some, it might be, and I put this in the same basket as trauma. For some people to think that, oh yeah, I've had a traumatic experience or I'm suffering, it has to be really profound. Whereas other people can go, no, it can actually be quite small. Where do you sit on that side of things? Well, how would you define suffering, I guess, to a bigger extent, trauma as well?
Yeah, right. That's really great. Kind of suffering is a part of life, really, isn't it? Which is somewhat disappointing thought, but it sort of is really, that's the reality of it. And I do feel like suffering can certainly be experienced at different levels and at different extents. You know, in a way, when I was off for my walk this morning, I'm sort of noticing my second toe, or at least the joint of that something. I'm not really a physiologist, but somewhere in there, I was noticing a niggling pain. You know, and so in a sense, that's suffering. You know, like it's not the worst thing in the world, of course, but you know, suffering to me is that kind of discomfort, disappointment, pain, trauma, and so on, different sort of extents of it. But I think the other thing that's really important about suffering is how we then respond within ourselves to those disappointments, discomforts, pain, and so on. And so I noticed my mind picking up on this little pain in the toe and thinking to myself, shit, you know, now this is going to get worse. I'm not going to be able to walk. What am I meant to do at my age to exercise? How am I supposed to keep fit? You know, I'm already getting checks on my heart, and, you know, like now I'm not going to be able to walk again, and so on, you know, just sort of went on. And so it's kind of, there's a sort of a Buddhist parable, I think, which is sort of the two arrows of suffering. You know, the first arrow is the very natural discomfort and pain and suffering that we experience in life. And then the second arrow is how we respond or interpret or relate to our own suffering. It's tricky. There are things we can do for that first arrow, but I suppose CFT and the compassion that we might bring to ourselves really starts to relate to that second arrow as well. A bit like self-criticism. You know, that would be an example of the second arrow. It's hard enough running a business, trying to grow it, doing all of the stuff that you're needing to do. But then to add self-criticism to that just kind of compounds the whole thing.
And that self-criticism can stop us in our tracks. It's like it stops us taking risks for the reward or trying new things or doing things a little bit differently. And then we get stuck in a bit of a rut. And I guess this is where maybe we need to start showing more self-compassion, because we get stuck in that loop, that negative loop, where it just goes on and on and on. And this is maybe where therapy can help to stop going through the loop and start ironing it out and seeing it for what it is. What you're saying is, it sounds very much like acceptance and commitment therapy. So the acknowledging stuff, it's the accepting stuff, and then in ACT, it's the committed action stuff as well. It sounds very similar.
Yeah, sometimes CFT gets referred to as one of the third wave cognitive behavioural therapies. The founder of CFT is a guy called Professor Paul Gilbert. You know, sometimes he balks at that idea. He sort of doesn't feel it is exactly a third wave therapy. He might say that it really is an integrated model. He draws upon, well, in particular, evolutionary theory is at the heart of CFT, really trying to understand our tricky brains, as he would say it. You know, we have tricky brains. He does it in a Derby accent, but but they're brains that have evolved over all of that time to help us to survive and so on. And this is the funny thing. Self-criticism itself is an evolved function of the brain. You can perhaps imagine, you know, the primitive human who desperately needs to be part of the group. You know, that's key for our survival. If we're kicked out of the group, we're dead, basically. So we need to stay in the group. So we evolved to be very good at kind of monitoring our place in the group, our value, our worth. And we evolved in some ways to feel this kind of tendency to be unworthy in the group, because if we sort of lean towards a kind of an unworthiness, that would motivate us to try harder and to do better and to be of more value to the group and therefore more safely in the group. So self-criticism is kind of an evolved part of the tricky brain. And actually a lot of people hold on sort of tightly to their self-criticism. You know, they feel that still, you know, that I don't want to be lax or lazy. You know, I don't want to become unmotivated. You know, I don't want to fail and so on. And so they feel like self-criticism is the thing that's going to keep them going and make them successful and that sort of thing. It's interesting because when you really look at the effect of self-criticism, there's a big relationship between self-criticism and depression, and self-criticism and less motivation and so on. But that can often be a block for people. They worry about losing their self-criticism. They worry about this will make them a failure and unworthy and no good. And so they resist self-compassion. They worry that self-compassion is going to take them in the wrong direction.
As you were talking about that, two things came to mind. One is around, you were talking about the primitive person, human. And as you were saying that, it felt like you were saying the birth of social constructs about what it means to be a man and a woman or non-binary or whatever. And for guys particularly, and I've experienced this myself, is we are self-critical to the sense of, am I being a boy or a man? Am I tough enough? Am I strong enough? Am I able to fix things? Can I get through this without having to ask for help? On the flip side of that, I was thinking about perfectionism. And so we're super self-critical because we want to be seen as perfect. But then once things aren't perfect, things can really unravel. We can either blow up like a volcano, we can get on the drugs, the alcohol, try to self-soothe, all these types of things. How hard do you find, or how much connected is this with masculinity and what guys go through in terms of their self-identity, or maybe they've had a relationship breakdown or something's happened at work, they lost their job? Talk us through your experience with working with guys in this space.
There is a sense that men, and myself included, we don't like vulnerability. We like to feel strong. And I remember working with a group of veterans. We ran a compassion-focused therapy group with veterans. And the common refrain really from them was, it sounds too much like self-pity. And that's the last thing I want, is to be self-pitying. And so often men can balk at this idea of self-pity or self-indulgence or being soft or weak. And also the other bit you picked up on is, how am I being seen in the minds of others? That's a very difficult one. And we don't want to be seen in the minds of others as inadequate or inferior, no good. Shame is a very critical aspect of this, I think, that we, that sort of sense of external shame, which is where, the other people see us as no good and so on. And then leading to internal shame, which is our own sense of ourselves as no good. And so often men will try to find some ways to feel stronger again or energized and also, sort of feel like they're not losing status in the group. Anger is potentially a part of that mix, becoming more angry or more aggressive or externalizing of blame, those kinds of things. And then we get into this big vicious cycle then, because perhaps we do get a bit angry or let off a bit of steam or something like that, and all of a sudden people around us are saying, see, you are a bad person or whatever. And then the shame kicks back in and we're caught in this very difficult, vicious cycle. We can talk more about some of these kind of blocks to self-compassion and how to deal with that. But yeah, I think that's where men get a little bit sort of caught in that little kind of cycle.
I can imagine when you're sitting in clinic or in a session and you start to utter the words compassion, some of the guys might be like, whoa, what are we about to dive into here? Because I have the same when I talk to guys about mindfulness. It's like, oh, that sounds a bit woo-woo or hippie or whatever. Talk us through something like, how do you navigate through a guy through starting to look at compassion as a process and as a therapy tool?
This is really great, because one of the things Paul Gilbert identified early on is that in CFT, first and foremost, we're trying to work with what he calls fears, blocks, and resistances to compassion. So that's a key thing. And it's an important thing to mention, because if anyone is listening and they're sort of noticing these fears, blocks, and resistances arise to the word compassion or self-compassion, well, that's actually very normal. Like all of us have reservations about this thing, and often it can be really to do with our kind of sense of what compassion even means. If a man thinks about compassion and the way they relate to it is that it is soft and gentle and sort of loving and cuddly and soft voices and things like that, they might think, well, it's dog eat dog out there, like I got to be tougher than that, sort of a thing. And so one of the things we really try to kind of break down is, what is compassion, or what are the qualities of compassion? In CFT, we're actually emphasizing things like wisdom, strength, courage, a commitment to being helpful. I mean, sometimes if it's in the middle of the night and your little baby is sick or something like that and crying and probably most men would go in and sort of, give them a pat or a cuddle and soft tones and it'll be okay and, you'll be all right. Let's just get back to sleep or something like that. But if your child is reaching for a boiling pot of water and you can see that disaster is about to happen, it's kind of like, no, don't, stop. You might even give them quite a fright, but that's compassionate still. Compassion is about being aware of suffering and doing something to alleviate it, and often strength and courage are the key to doing that. So I think that's really a big one for people to explore. They'll have these little blocks to compassion and self-compassion. So let's start by thinking what we really mean by that and really focusing in on wisdom, but strength and courage and commitment to being helpful.
I love those words, strength and courage. Often talking to the guys that I work with about resilience. And they're like, I'm not a resilient person. And I see that as being strong and courageous is tuning into your resilience. All the times you've been knocked down before and you've got up and you've gone again and you keep doing this, or you keep rocking up to therapy even though you don't know what to talk about. Or the update is, it's the same old. But this is resilience. This is building up more strength and more tools for your mental health toolkit, or however you want to describe it. So how do you support guys that you've started talking about compassion and these other buzzwords as well? Talk us through how you navigate that into a session. How do you work with guys and start developing their self-compassion as well?
Well, actually, step one really is to bring it back to the body a little bit. That I think you've probably found as well, that sort of therapy and working with people really has moved towards a kind of body-based aspect to it, trying to cultivate that sense of strength and courage, but groundedness, stability, calmness in the body. And so we probably often would begin there. We start to think about various practices. Mindfulness might come into that, actually, because compassion is about sensitivity and awareness. And so we cultivate mindfulness. We might use certain body posture, facial expression, inner voice tone, and breathing practices to kind of really create that in the body. The next thing we might try to do is really have a sense of how to feel safe. Because quite often men are in a situation where they're largely threat system activated a lot of the time. A lot of the time there are social threats, sometimes there are physical threats or emotional threats. And so they're kind of threat system activated, fight, flight, freeze, appease, or whatever. And so, using imagery techniques to start to remember, I guess, what it feels like to feel safe. We might use imagery of a safe place, for example, or we might start to use imagery of maybe there was a person in their life with whom they felt safe, a teacher or a coach or a relative or a friend, and start to build some of that into the imagery. And then we start to think, okay, so what are some memories of what it feels like either to be compassionate or to receive compassion, or maybe even to witness an act of compassion, because we're then wanting to sort of start to get some clues about, just what that might look and feel like, so that we can then start to sort of enact that a little bit, cultivate that part of ourselves that really is compassionate, because compassion evolved too. Like our tricky brain evolved, but so did our compassion as a human kind of quality. So really trying to tap into that, embody that compassionate part of ourselves, and then start to direct it, maybe to others, but also to ourselves. Just a last little example. I was working with a man just yesterday, and we were talking about self-compassion, and he was like, WTF, kind of thing, trying to work out what on earth I was on about. And we use this little notion of, okay, let's say you're walking along the beach and you kind of stumble across a turtle that's stranded on the beach, wrapped up in fishing line, say, suffering in a sense. What do you do? And he said, I'd go over, I'd try to work this out, I'd maybe get some scissors and cut the line off and I'd do something, to help it. And then I said, and it's funny, like just imagine what sort of things would you be saying to this turtle? I know it's a turtle that can't speak, but it's a bit like, with our pets or our dogs or our animals, we talk to them sometimes. And he goes, I'd probably be saying, you'll be right, mate. I got you. Steady on. We can get through this. Here you go. You'll be right. And I'm like, that's compassion. Now, not only is that compassion, but self-compassion is just when you're the one walking along the beach and you're the turtle caught up in that fishing line. It's just about identifying our own suffering, doing something to help, and often coming along with that kind of, sort of reassuring, encouraging, supportive, helpful voice tone, saying little things to ourselves that just keep us going.
I really love that example. And it took me back to when you was talking about feeling safe. And I've only recently come out about my alcohol struggles over 25 years and been sober since I was, turned 40 in August this year. And during this time, I've been tuning more into why have I been drinking for so long? And then I was listening to an amazing podcast where they were talking about drinking, but this lady was also talking about her lived experience of OCD, so obsessive compulsive disorder, and how she was using alcohol as a way to feel safe, to slow the mind, to numb everything, to feel safe. And there was a moment in the podcast where she said she was talking to somebody else and the other person said, you don't need to continue drinking because you're safe now. You don't need to keep tuning into your OCD because you're safe now. Whatever started this all these decades ago has gone, has passed. You don't longer have to be like this warrior that's always on alert. You can now let your guard down. You've come through it. And that really resonated with me. And as you're talking about that, that's that self-compassion is like knowing in myself since I turned 40 and stopped drinking. So I don't need to drink to feel normal. I don't need to drink to numb anything because the pain's gone. I've been holding on to this like a warrior, thinking that it's protecting me like a coat of arms. But in reality, it was just excess baggage. And it took a lot of that internal self-compassion, that acceptance, that acknowledgement. You know what? I've been doing this thing for a long time. It's now time to do something different, to use that self-compassion to move in a way that I actually want to live, and I probably have wanted to live that way for 25 years. And so it's really interesting that you say that and use that analogy as well, because often when I'm walking on the beach, and that's my reflective times as well, or I'm walking around the park, I'm reflecting on how I'm going, how my clients are going, how my family's going, and my friends, and how I interact with that, how the world's going as well, and just try to find those moments of self-compassion to fill our cups up as well. I'm interested with the work that you do with guys. Is there like certain guys that this works well with? Are there certain guys that this doesn't work well with?
I think that there's a bit of an assumption sometimes that I notice amongst therapists that men won't like it as much or something. And sometimes people even feel like they need to shy away from the word compassion, because they're worried that if they use words like that, that somehow men won't really relate to it or won't be of interest. But to be honest, I don't feel that way. I think on an individual basis, there are some people who are potentially less kind of interested in this approach and that kind of thing. But I'm not sure that there are sort of groups of men or men in general or that sort of thing that are just kind of somehow categorically not suited to it. I have worked in a compassion-focused way with some men who have pretty rugged backgrounds, as I say, military people, but police officers, lawyers. I can think of a lawyer recently he was a bit like you describe, the alcohol was really a key part of his coping. But it was about threat as well, now that I'm thinking out loud, because I remember he said to me something like, I don't mind about the opposition lawyers or the opposition client. I'm not worried about them. I'm not worried about the courts or, kind of that sort of thing. My biggest threat is the guy in the next office because he's competing with me. He's trying to get, my clients or whatever. And I thought, wow, that's tough, that basically your own group is where the actual threats are coming from. And so, alcohol became a part for kind of managing threat and that sort of thing. But if you pitch it right, if you kind of spend enough time just exploring this word, acknowledging and accepting that there will be some blocks, exploring it further, starting to kind of get a real sense of the definition and how to interpret it and what it involves, especially when we drill down to wisdom, strength, and courage, I think a lot of people can take that on board. If you think about compassionate action, like yours, your decision to stop drinking, I mean, maybe sometimes compassion is sort of, curling up under a blankie and eating ice cream and watching Netflix, like that's okay, I suppose, that might be compassion sometimes. But often self-compassion is the much tougher road. It's the road that we need to take because we wisely know that it's in our best interests in terms of our health and well-being. Bit like me and my walking too, or for me at the moment, it's like I got to get my taxes done, because I lie awake at night worrying about that and then get up the next morning and don't quite do it. But it would be a self-compassionate action, actually, to get those taxes done and submitted because it would mean less suffering for me, less anxiety, less worry, fewer emails from my accountant, whatever. So often self-compassion is the tougher choices, the tougher road, but in the service of health and well-being.
With any therapy approach, like the therapeutic rapport or relationship that you have between clinician and client is instrumental for them to actually go, you know what, I'm going to give this a go. And without naming any names for privacy reasons, is there anything that sticks out to your mind? I'm going to pitch it to this guy. I'm not sure how he's going to take it, or he's going to just deflect it out of the way, but then he's become like that star pupil for you. Have you had anything like that happen?
Yeah, actually, I can remember one guy, for example, who was a youngish guy, engineer or something like that, some sort of profession, but in that kind of what sometimes gets thought of as slightly less emotion-focused career and more technical-focused. And we did some sort of embodiment work. I kind of got him to stand up and to kind of assume the posture of a compassionate person. And he just flatly refused. He was like, this is stupid, whatever. And he went bright red in the face, the poor guy. And I realized really it was really a moment of rupture in the therapeutic relationship, actually, for him. He was too much too soon, I think, really, or something like that. But, I did my best to kind of work through that and we, thankfully he stayed committed and he came again and so on. And just the other day, like he's pulling out his little notebook because he's become a real journaler, or whatever. And he just read me this passage and I'm not sure what everyone will think about this, but it sort of brought tears to my eyes just hearing the compassion in his notes to himself and his the way that he was just really validating a particular experience he'd had, reassuring himself about it, encouraging himself about it, coming up with, what to do next to try to help it. And I was really sort of blown away. This guy who had really balked at the whole thing quite dramatically was now this self-compassion champion or something like that. It was a lovely moment.
Yeah. How did you show self-compassion to yourself? Because I know as a therapist myself, when something doesn't quite go right, imposter syndrome comes in and tells me I'm terrible as a therapist. How did you navigate that particular situation?
Yeah. I actually, self-compassion, self-care for the therapist is a really big topic as well, isn't it? And I've really become very curious about just the notion of clinician shame, that as clinicians, we can get lost in some of that self-criticism and shame, feeling like I'm no good at this. The person in the next room is much better than me. If someone really knew what I was doing in here, I'd be exposed as a fraud or whatever. And those moments where something goes wrong in therapy can really, sort of spark all of that, kind of thing. And I think in that moment I was relatively okay. I mean, I do have a sense that sometimes these ruptures actually can be, if they're managed well, they can be quite powerful moments in therapy that actually sort of becomes a kind of a jolt forward in progress. And so I do remember, again, bringing it back to the body, just trying to stay calm, trying to breathe, going back to listening, and ultimately I think I did offer just an apology to that guy. I said, "Oh, look, sorry, I realise I've gone a bit fast on that one. It's a bit soon or something. Let's just stop that and have a little think, like what happened there," and tried to return more to empathy and understanding and sort of hopeful that he would also return the next time.
We do very hard on ourselves as practitioners. And I've even taken self-compassion to the next level and put it in my service agreement with clients that I have a no magic wand clause. And I say it to the guys I work with. I've got, we can come in and do all the work, but I cannot guarantee you that this will actually help you in any sort of way. And they all laugh at it when we talk about it. And we just acknowledge that this is a human experience, is that there's no magic wand. I can't fix them. They're there to work on themselves. I'm there to guide that process and provide little tips and tools along the way. In terms of clinicians being really hard on themselves, I also noticed this in the lived experience sector of clinicians. So I'm a proud lived experience therapist. I fly that as a flag and say, yep, if you want to talk about depression, you want to talk about anxiety, OCD, masculinity, alcohol misuse, I'm happy to talk about all that in sessions, and I will share what I need to share, providing that it's not oversharing. These sessions are about you, but where it's necessary. But I know some other clinicians who are lived experience clinicians, they feel a lot of shame bringing that lived experience to the therapeutic relationship, which can often really be helpful for guys if they know that the clinician has kind of walked a similar path to them. I'd love to hear your thoughts on this as clinicians who are, and there are a few clinicians that listen to this, about being self-compassionate if they are lived experience clinicians and how they can use that maybe to their advantage.
It's a very powerful aspect of kind of the therapeutic relationship, feeling safe, feeling hopeful for the client. All of those things can be quite powerfully influenced, I think, with the clinician or therapist with lived experience. In fact, in some ways, if you come across as a therapist, without any problems or somehow having a perfect life, that's sort of a negative effect, which is ironic, isn't it? I mean, sometimes therapists still have a kind of a perfectionism or a kind of a very high standard of themselves, forgetting that actually we don't want to be too perfect. We want to be relatable and safe and avoid those sort of almost competitive motives that can arise. And so, we want to be able to be authentic, be ourselves, show that we too suffer and have suffered and in one way or another have managed to sort of cope with that or move through that. It can still be tricky. The humility piece is really important as well. I suppose we do need to also have nice, healthy boundaries and be able to work out for ourselves, like what is okay to share and explore and so on, and what's sort of maybe not okay for me, and I'll sort of keep those moments to myself. Sometimes self-disclosure can be powerful, as we say, but sometimes it can take the focus off the client and become more about you. I had a client during the week who has just got a golden retriever puppy and I felt an immediate urge to disclose how my Labrador had recently, sadly, died. And it would not have been appropriate to express that little piece of personal experience, in the context of all that she was going through and the way that this puppy was actually a really one positive thing that she was experiencing. So, but of course, I think those boundaries are also important for ourselves as well, to maintain that sense of, kind of our own privacy and kind of trying to manage that not everyone, even if they're going through a similar thing, will do it the same way we did it, I guess. And so, kind of managing some of that.
Stan, I could talk about this all day. Like, this is actually a really interesting topic, which I'm going to go do some CPD on, some learning on after, in my next 12 months as well, because I'm looking at what I'm going to study in
Yes, good.
the next 12 months. So it is really interesting because I am talking about this a lot with guys that I work with. And I find that they really do enjoy talking about this type of stuff. When somebody else is sharing compassion or self-compassion in a way that guys can understand, then they go, okay, yeah, I can actually feel these things. I'm allowed to feel these things. You're talking about them, so obviously I can talk about them too. So thank you for sharing about it today. Is there anything that we haven't touched on that you wanted to really share about CFT for the audience, to maybe if they're thinking about doing it, what could get them across the line and come and book in a session with you to do some work on this area?
There's probably two little bits, one slightly nerdy, I guess, and the other practical. It's not a big surprise that you haven't heard much about it. I mean, it's actually not that new. Paul Gilbert's first book, The Compassionate Mind, was 2009, I think, but from a research perspective, it's really starting to kind of get going with some randomized controlled trials and an evidence base. It's been found to be quite helpful with things like post-traumatic stress disorder or people who are recovering or survivors of childhood abuse. Eating disorders is another big area that CFT has been used in. Depression and anxiety, of course. So that's probably one thing, is just to kind of give you that little sort of sense that the science is really starting to kind of advocate for the effectiveness of this approach. And the other thing I would just leave as a thought to ponder for everyone is like what might be the steps of a self-compassionate response to oneself in a difficult moment. And I suppose for me it goes in 4 steps. As sort of the first is a validation. So we're trying to validate ourselves, validate our emotions. This is okay. This is legitimate. It is reasonable that you might be feeling this way. The second is a kind of a reassurance. Things will change. Things will pass. Things will be okay. You can cope with this too. The third is affirmation. What are your strengths here? Like, let's just affirm my own strengths. I am a resilient person. I have been through things before. And then the final one is encouragement. Okay, so what could I do next that will be most helpful for me, that will kind of take me in a valued direction, that will help to maybe just even slightly alleviate this suffering? If you think those 4 little steps, validation, reassurance, affirmation, and encouragement, then that's starting, I think, to move you towards something kind of practical in terms of self-compassionate, self-relating.
If people are interested to do some work with you, how can they find you? How can they hear more about what you're doing? I know you've got the YouTube channel as well. Do you want to plug that too?
I do a few little things like that. Yeah, so I've got a YouTube channel. I call it affectionately Compassion in a T-shirt. And here's my kind of compassion T-shirt that I'm wearing today in honor of your podcast. Psychologyconsultants.com.au is the website where you can find me and the various other practitioners in our work. And if anyone does want to be in touch, Stan at psychologyconsultants.com.au is my email address. Always happy to, even just if people are interested in, articles or things to read or places to go, more than happy to hear from you and quite keen to spread the word.
And I'll put all the links and the email in the show notes so people can access that and get in touch if they want to. But Stan, I have really enjoyed this discussion, and there's one final question that I ask every single guest that comes on the show. We do talk about some heavy stuff. We talked a lot about self-compassion today and some of the negative aspects that might lead us to try to do more work in that area. I'd like to leave it on something lighter. So something that I'd love for you to plug, something that's making you feel good at the moment, whether it's something you're watching on TV or listening to, a book you're reading, an article you've read, a self-care activity, just to inspire our audience to maybe go check that out for themselves.
Actually, I do have various TV shows and stuff like that, but I think what I would like to say is that the definition of compassion really is starting to widen to include flourishing, actually. So it is kind of heavy to be thinking about compassion, being really related to suffering, which it is. And so it is heavy kind of stuff. It's a bit different to just kindness like that. Kindness doesn't need to involve suffering, but, compassion kind of does. But it really is also incorporating the idea of flourishing. And you'll be potentially surprised if you start to live a more compassionate life, starting to notice suffering and starting to take helpful action. It actually, not only does it have a benefit for the other person, it has a benefit for the compassionate person as well. And Matthew Ricard sort of talks about the twofold benefit of compassion. And that's okay. Compassion doesn't have to be completely selfless. So looking for little ways in your day to just little acts of compassion. It'll feel good for you and it'll spread from there.
Great tip. Great plug. I love that. Again, Stan, thanks for so much for coming on, sharing your wisdom and your insights into compassion-focused therapy. I really have enjoyed it. It's opened up my eyes as a practitioner to maybe look into this a bit more. Thanks so much for coming on.
Thanks for having me.
Well, that's a wrap for today's episode, and I hope you got some value from it. If anything triggered your mental health today, please reach out to your support networks. Also, if you loved what you heard, be sure to subscribe to the show and share it with your mates. For more from Mindful Men, you can check us out on Instagram and YouTube, and I'll throw the links to these pages in the show notes below. But until next time, stay mindful.